Now, the 12th edition of the Zimbabwe Uniformed Forces Health Services annual conference is underway in Bulawayo, with participants calling for stronger government support for national health initiatives. Now, the three-day conference brings together regional and international stakeholders, including SADC countries and delegates from as far afield as Kenya and Nigeria.
This year's conference runs under the theme Healthy Uniformed Forces, Addressing HIV and AIDS and Contemporary Health Threats. The conference will run over the next 3 days, bringing together regional and international partners to strengthen health strategies for uniformed forces and communities, and to find sustainable solutions to contemporary health threats. Commander of the Zimbabwe Defense Forces, General Philip Valerio Swanda, said contemporary health challenges were not isolated as they form a synergic threat to servicemen and women, operational readiness and regional security.
Healthy uniformed forces addressing HIV, AIDS and contemporary health threats. This is not merely a topic, but is a call to action. Our forces face dual crises from the persistent adversary of HIV and AIDS and emerging threats like substance abuse, mental health strains, other infectious diseases, and the impact of climate change and technology.
General Swanda urged countries to prioritize prevention and ensure stigma-free access to antiretroviral treatment, saying uniformed forces face a dual crisis from HIV and AIDS, as well as drug and substance abuse, mental health challenges, other infectious diseases, and the impacts of climate change.
These are not isolated challenges. They form a synergistic threat to our servicemen and servicewomen's readiness, operational effectiveness, and a threat to regional security.
Director General in charge of health services for the Zimbabwe Defense Forces, Brigadier General Godfrey Mutsetse, said the conference is meant to promote research within the uniformed forces. It is out of this research that the forces craft policies and strategies to improve the health of uniformed forces and that of communities through collaborations with the Ministry of Health, the National AIDS Council, and defense forces from across the SADC region and beyond.
Zimbabwe Defense Forces Community Assistance Week was there to put what we preach into action and also forge good relations with the communities within which we work. And the structures that the Zimbabwe Defense Forces put up are actually resilient structures that take into recognition issues related to climate change and accompanying disasters like cyclones that often take place.
Addressing the same conference, National AIDS Council Chief Executive Officer Dr. Bernard Matsima highlighted the Council's efforts to strengthen health systems and sustain HIV programs despite funding challenges.
In the uniformed forces, they have the health departments, and over the next 3 days, they are going to share evidence-based researches which they've undertaken, but not only within Zimbabwe. We also have colleagues who have come from SADC countries, and as far as outside SADC, Nigeria is also represented, and Kenya. So it's a platform where we are using evidence-based information on HIV and AIDS.
He said the platform allows for the sharing on issues of HIV and AIDS and broader health matters, this year focusing on health financing and the sustainability of HIV programs which have been affected by funding cuts from the United States government.
But this year it's also important because we are discussing issues of health financing and sustainability of HIV programs. We know that there's been reduced or funding is stopped, especially from the US government. We've had this fund being stopped. This has affected our supply chain in terms of ARVs, in terms of agricultural commodities, but also health workers some health workers have been laid off.
As deliberations at the conference continue, delegates are expected to agree on strategies to boost health services and funding across the region, ensuring that prevention and treatment programs continue without interruption. For ZTN Prime, I'm Andile Chuma in Bulawayo.